am the Joint Prevention and Control Mechanism presser. In the last one day, in 31 provinces, including Xinjiang, have reported 1,251 confirmed cases and 23,295 asymptomatic carriers. 1,641 cured cases and 2,520 asymptomatic carriers have been discharged, including 273 from Shanghai discharged from hospital and 380 asymptomatic carriers discharged. And the cumulative asymptomatic carriers out of observation stood at 4,843. So now, the COVID-19 is still in a critical situation, and our prevention and control must work at this moment. We must be committed to the dynamic zero-case policy and unswervingly support it. We must take decided measures in order to implement and execute those policies to the full. We must act quickly in terms of our nucleic acid testing, the temporary hospital establishment, the accommodation of those infected people to cut off the transmission in the society. We must have a quick screening to discover the potential source of infection and put them in quarantine as early as possible. We must also guarantee that people's basic needs are met, especially the medical needs. We must always take the protective measures and get vaccination, especially the vaccination among the elderly people. By the end of the 11th, the cumulative reported vaccines were about 3.3 billion doses. And for the people completing all the doses, the number is 1.24 billion. According to the CPC Central Committee arrangement, up until now, the NDRC has dispatched 40,000 medics from 16 provinces and 2.38 million agents for the nucleic acid tests in Shanghai. Today's presser is themed under the prevention and control of the pandemic in a pragmatic and stringent way. We have invited the NDRC Economic Cooperation Bureau Deputy Director General Xu Zhengbing, from the MOFCOM, Madam Li Danghui, from the National Health Commission, Mr. Lei Zhenglong, from the CDC, Epidemiology Co-Chief Expert, Mr. Wu Zunyou, from the Immunology Planning Expert, Mr. Fang. Now they will take your questions. And please identify yourself before raising the question. Please. My question is, what is your judgment about the current pandemic situation in China? Mr. Lei Zhenglong. Thank you for the question. Since March the 1st until the end of 11th April, in 31 provinces, autonomous regions, and Xinjiang, the cumulative reported positive cases were 32,503, covering over 30 provinces and municipalities. And with the different containment measures in place, the places witnessing the new outbreak of the pandemic raise their awareness of this pandemic, so there is no concentrated outbreak. In Hebei, Jiangsu, Anhui, Guangdong, Fujian, Zhejiang, and Shandong provinces, the pandemic is in control right now. In Jilin province, the pandemic is being curbed and go downward trend right now. And the newly added infected people are now controlled below 1,000 every day, but it's still very high level. In Changchun City, the daily new confirmed cases are decreasing in number, but they haven't cut off the transmission chain in the controlled areas yet, so they still need to step up their efforts in the controlled area. In 8 consecutive days in Shanghai, the newly confirmed case have been over 10,000 in total. So the transmission chain in the society is not cut off yet, and it has a spillover effect over the other provinces and cities. The newly infected people will still stand at a high level in the next coming days. Recently, in China, it is challenging to curb the transmission of the virus, so we cannot drop the vigilance. The joint prevention and control mechanism of the State Council require us to avoid imported cases and domestic resurgence of an outbreak, and we must be committed to the dynamic zero-case policy and execute the policies to the full onto the ground, and we must hold the different responsible entities accountable, and we must standardize our management of the key public places so that we can generate fruitful results. Thank you. Next question. From the CMG. The question is, since we have a sporadic outbreak of the pandemic in China, my question is to the NDRC, what will be the measures taken about the guarantee of supplies? Mr. Xu. Thank you for the question. It is fair to say that in some portion of our country, since the resurgence of the pandemic, according to the CPC Central Committee arrangement, the NDRC have kicked off the necessity supply guarantee work. The Ministry of Transportation, MOFCOM, and Ministry of Agriculture work together with the different localities to guide them in detailizing the measures and policies of supplies guarantee and the support in solving the difficulties. And we have done the following. First, we coordinate in terms of the daily report of the necessity supplies in the prioritized areas. Based on the warehousing of the government and the price change and fluctuation in the market, we aim to discover any occurring problems instantly and take up the measures to resolve them. And we must set up a coordination mechanism in certain provinces. We must get an instant knowledge about the life necessity supply situation and the difficulties in the prioritized provinces and municipalities to solve them. And secondly, we urge the localities in Shanxi, Shandong, Guangxi, Jilin, and Shanghai. We have sent our letters to the local governments in order to further improve their policies, in order to ensure the necessity supply. And we will immediately help the localities in solving the prominent issues. And we also harness the power of the big data to trace the situation of the supplies on our network so as to coordinate in different localities all sorts of problems. Thirdly, the connection between production and sales. We work together with the MOFCOM, Ministry of Transportation, the Ministry of Agriculture and Rural Areas in terms of information sharing. And we have a division of labor in terms of the dispatchment, the transportation, the production, and different links. We ministries are working together so as to do a good job in terms of the coordination between the several links. For example, we will give alerts to the supermarkets in terms of storing supplies once there is a shortage. And we also launched such a mechanism of joint guarantee of supplies in the prioritized provinces and municipalities with the surrounding areas, so as build such a fast track of the logistics for the necessity supplies. And as to Jilin and Shanghai, where people suffered the most in the country, the NDRC has specially set up a panel of experts so that the entities in Jilin and Shanghai will connect with us on a daily basis, and we have established a provincial-level joint supply system in Jilin and Shanghai. We organize the different production areas in Jilin and Shanghai in terms to supply and transport the vegetables and food necessities. We establish the green channels for such transportation. And also we actively work together with the other national entities so that we can pivot towards Shanghai in terms of life necessities. Right now, several batches of rice and vegetables have been delivered to Shanghai through the railways. And together with Jiangsu and Zhejiang provinces, we have set up the transfer stations so as to support Shanghai. You may have read the news already. Kunshan in Jiangsu and Pinghu in Zhejiang transfer stations are already put into operation right now. As to Jiashan transfer station, it's already reformed and can be put into operation anytime. In the next step, the NDRC will continue to give full play to the special panel of the Joint Prevention and Mechanism by working together with certain responsible entities so as to monitor the life necessity supply and the coordination of production and sales. We will try to smooth away the logistics and transportation and urge different localities to solve the last 1 kilometer and last 100-meter delivery issues. And we'd love to cooperate in terms of guaranteeing the supplies. Next question. From the Xinhua News Agency. Since early this year, the pandemic has broken out several times. And what has the MOFCOM done in terms of guaranteeing the necessity supplies? Madam Li, thank you for the question. This year, we've seen frequent outbreak of the pandemic in China, and that was quite a shock to the insurance of supplies. As to the role of MOFCOM, we are committed to the State Council's decisions under the umbrella of the Joint Prevention and Control Mechanism. We adhere to the overall policies, and we go all out in terms of guaranteeing the supplies of life necessities, and we work on the following 5 fields. First of all, we guide different localities to strengthen their prevention and control measures. For example, in the commercial field, pandemic prevention and control is key, and it's the precondition of the containment. And since Omicron has high transmissibility and it's insidious, so we will offer immediate guidance to the local commercial bureaus by urging the hotels, supermarkets, shopping malls, and the other circulation entities to have a good control of the public places and the employees, so that they can execute the containment measures to the full. And as to the key personnel, we ask them to enhance the closed-loop management and keep tight control of the entrance and exits so that they can create a reassured environment of consumption. Secondly, market early warning system. By following the news of the pandemic, we will categorize our monitoring systems and reporting systems of the consumables. For example, we will dynamically monitor the life necessity supplies in different localities, as well as their guarantee situation and their warehousing status, especially in the key places. We will dispatch the dedicated person to connect with the big supermarkets, the warehouses, and logistics centers so as to acquire the number of supplies. And we can have some instant introduction and publishing of the information. And thirdly, we will take customized measures to guide the supply guarantee. Since early this year, the commercial system in China has been activated, and the MOFCOM asked the special panels of our ministry to keep up the operation. We monitor closely the pandemic situation across the whole country, and in consideration of our experience in different localities in terms of the supply guarantee, we have compiled some documents, for example, a manual about the market supply guarantee. We urge different localities to do pragmatically in guaranteeing the supplies. Together with Tianjin, Henan, Shanxi, Guangdong, Jilin, Shanghai, we set up such a tiered mechanism and a coordination mechanism so as to solve the problems in terms of the emergent supplies. And fourthly, stable supplies in the severely hit places, for example, in Shanghai and Jilin. MOFCOM has established such a joint supply mechanism. That's one of our highlights in the past years. We have stepped up our support by mobilizing resources leading towards those severely suffering places. For example, we guide the surroundings of Shanghai to establish a transfer station for Shanghai with zero contact. As to cross-regional transportation, we hope to reduce the risk of transmission and ensure the stability of the supplies through those transfer stations. That's the fourth task. Fifthly, we give full play to the role of the backbone enterprises because for the invisible hand of the market to play its role, the entities are prominent. We ask the entities to connect with the affected provinces, especially the SOEs, to lean more towards the dispatchment of those materials to the severely suffering places. We urge the localities to give full play to their local entities, especially the local supermarkets. Under the precondition of good containment measures, they must have a good judgment of the local demand and have longer operational and business hours and have more backup supplies. Yesterday, Shanghai published the 1,814 supermarkets in charge of the supply insurance in Shanghai. So we will continue such good job. Next question. From the Phoenix TV. Are the symptoms very severe by Omicron, especially among the elderly people? Mr. Wang Huaqing. Thank you for raising such a question about the elderly people, especially considering the necessity of vaccination. The Omicron variant may lead to severe symptoms or even death. Since countries have different monitoring criteria and different infection background and vaccination ratio and different affected groups, we have read some data stating that the ratio of mortality led by Omicron is different in different countries. But I still have to say that for the elderly people, especially those suffering from mild diseases, once infected by Omicron, the ratio of mortality is very high. That's quite worrisome to us. According to the WHO data about the incidence ratio and the mortality ratio across the world, during the infectious period of Omicron, we have seen a high rocketing ratio of incidence. In addition, the number of mortality has come up to a new high. And in some places, they have already hit the record in terms of the fatality rate. Especially in the U.S., in the past 5 weeks in a row, the reported number of fatality has reached 15,000. According to the data about Hong Kong, in Hong Kong SAR, during the time of Omicron transmission, the cumulative reported fatality ratio is 2.87. And as to the elderly people above 80 years old, once unvaccinated, their ratio of mortality may be 15.68. According to the newest finding in Hong Kong, in this round of Omicron outbreak, for the elderly people above 60 years old, their risk of death is 252 times more than that of the people below 30 years old. So it is obvious that for the elderly people, especially those haven't receiving vaccination, it's quite risky. Next question. From the CMG. According to some people, there may be a middle way between the dynamic zero case and just giving up. So, do you think there is a middle way? Is it feasible? Mr. Wu Zunyo. As the policy of prevention and control, we have been discovering, based on our renewed understanding of this virus. Once the COVID-19 hit the city of Wuhan, based on our past experience in preventing and controlling other diseases, particularly like SARS and other respiratory system diseases, we undertook the measures dominated by physical isolation. And we successfully conquered that virus. Domestically, we have basically eradicated the cases, and later on, the cases broke out mainly through the imported channels. With one case in the picture, we will take similar measures to eradicate it. So our application of containment measures has been quite successful. And to put it simply, we call it the dynamic zero COVID policy. And the main objective is to do whatever we can to ensure people's life and safety. For various countries, the consensus is that through effective containment measures, we can minimize the impact of COVID on people's life. When vaccines were out of the picture, we undertook the measure of physical isolation. For example, limiting the mobility of people, wearing facial masks, keeping a social distance, keep a good sanitation of your hands, and a good ventilation. The implementation of the above-mentioned measures require powerful coordination. People across the whole country must be supportive and work as one mind. And in some countries, such a physical isolation measure was not feasible. They failed to accomplish it, especially when it requires a sustainable commitment to it in the long run. Then, with the surfacing of vaccines and the wide vaccination, we have another means in reducing the fatality rate and the severe symptoms of the infected people. Some countries have resorted to giving up because after years of exploration, they failed to find an ideal policy of controlling the transmission of the virus. That's why they were reduced to giving up. But that's only adopted when all the other means don't work out with the vaccination already done. In some countries, they have found that after giving up, the number of deaths has risen quickly. And then they relented, and they add in the containment measures again. 2 years of practices in China testify that the dynamic zero-COVID policy is suitable and is the best scenario choice for us to contain the transmission of the virus. Thank you.
谢谢主持人，东方卫视记者提问。近期有言论认为呢，无症状感染者的比例大，集中隔离呢。
Thank you from the Dragon TV. People tend to believe that with the rising number of asymptomatic carriers and the centralized isolation is risky, so they recommend stay-at-home isolation. But some others argue that that may harbor the possibility of the infection in the society. So how to strike a balance between the isolation in the facilities and at home? Mr. Wu Zunyou. Thank you for the question. First of all, for the asymptomatic carriers, we must hold a scientific knowledge of them. Once a person is diagnosed as an asymptomatic carrier, this person might be in the incubation period of a confirmed case. After some time of observation, symptoms may occur on that asymptomatic carrier, or may even progress to be severe case without immediate treatment. That's very risky. So, some part of the discovered patients are in the incubation period. They're different from the asymptomatic carriers. If we keep that portion of the patients at home, it's quite dangerous. First of all, this group of people may further be contagious. And secondly, for these people themselves, without immediate discovery of the progression of their disease, they may miss the golden time of treatment and further progress to be severe disease. It's even a threat to their life. So, the centralized isolation has 3 advantages for this group of people. First of all, for the collective isolation facility, it accommodates the confirmed cases, so there will be no further transmission outward, or there will be no cross-infection. And secondly, during the centralized isolation period, those patients can receive the administration of TCMs that will help boosting their immunology system and preventing them to further progress to be severe cases. And third of all, through the centralized observation, if the patients do progress to be severe cases with immediate discovery in the facility, they can be transferred to other hospitals for treatment. So we recommend that we send those confirmed cases to designated hospitals as soon as possible. Thank you. From the 21st Century Economics. Some elderly people are used to living indoors or in the nursery homes, and their family members tend to believe that their elderly family members have very limited contact with the people outside. And since those elderly people usually have some mild diseases, they have a lot of worries about getting vaccinated. So what recommendations can you give to the elderly people and their family members? Mr. Wang Huaqing. Actually, even no contact with the outside world doesn't equalize with no infection at all. The elderly people are vulnerable. First of all, they are in their old age. And secondly, the majority of them suffer from the mild diseases. If in the nursery homes, they have been living with the other people. Once infected, it will be contagious on a wide range. During the Omicron transmission period, according to the Health Commission in Hong Kong, SAR, we can notice that among the 8,200 death cases, the majority of them are elderly people, and the median age is 86 years old, and 90% of those people suffer from mild diseases. Aside from those, in the nursery homes, 50% of those death cases live in those nursery homes. Speaking of Omicron variant, we are crystal clear about its characteristics. The first one is it has high transmissibility and quick transmission, and it's also very insidious. So, once it's prevalent, the risk of getting infected among the elderly people is rising up. Among the three risky factors leading to the severe symptoms, for example, mild diseases, chronic diseases, and old age are two of them. But getting vaccinated can help to reduce the fatality rate among the elderly people. In Hong Kong, they have some statistics about the Omicron transmission, and the data have been published in their Health Commission official website. Among the death cases, 74% of them have never been vaccinated, and 14% of them have only gotten one dosage. We come to the conclusion that even vaccination cannot cut off the transmission outright. It works well in guarding against this virus. So we recommend the elderly people to get vaccinated as early as possible. And once you are qualified, come to the vaccination station as early as possible. It takes time for the vaccines to work, and it requires a completion of the several doses of the complete procedure. So once your immunological system is fading away, so please go to the vaccination resort. Next question. From China Daily. In several localities, they have found the positive cases through the objects. So what is the possibility of being infected by the objects, and why haven't we found about this new transmission channel aside from the cold chain? And also we know that as to the imported goods and items through the customs office, it is widespread and it stands at a large number. So how to better control it? Mr. Wu Zunyo. Speaking of the respiratory disease, it's usually infected through a short distance fluids or through contacts. For example, you have touched the surface of that polluted items. That items haven't been disinfected, and you touch it, and then you touch your eyes or nose or mouth with your hands, then you might be infected. So the good sanitation of your hands is the first step. That's mainly because Omicron has shown some symptoms of infection in both the upper respiratory system and the lower respiratory system. For the upper respiratory system infection, the prominent features are quick transmissibility and short incubation period. So it has a very strong pollution effect over the objects. As to the survival time of that virus on the surface of the objects, it depends on the size of that virus and also the sunlight, the temperature, the humidity of that environment. Usually the risk of being infected by the objects is small, but if we have frequent contact with that polluted item, and you do not pay attention to your sanitation of your hands and don't take any other personal protection measures, then it's very risky. For the personnel in the business of cold chain or logistics, please get a regular monitor of your health in order to have an instant discovery of the infected people. For the general public, if you receive any package from the delivery people, after disinfecting the package, you can open it, and that will help to reduce the risk of being infected. And on a daily basis, please wash your hands frequently. Once you keep a good sanitation of your hands, you can greatly reduce the risk of being infected by the virus. Next question. From Guangming Daily, what is the update about vaccination in China, especially the booster? And what about the vaccination among the elderly people? Mr. Lei Zhenglong. Thank you for the questions. According to the arrangement of the State Council, right now we are continuing to urge different localities to prevail the vaccination. In 31 provinces, the cumulative reported vaccination was 3.3 billion doses. The total number of population vaccinated reached 1.28156 billion, and 1.244 billion people have completed the procedure. That's about 90.8% of the total population in China. As to those completing the boosters, that number is 700 million. And for the elderly people above 60 years old, the coverage ratio of their vaccination is 200 million, and 213.29 million elderly people have completed the whole procedure of vaccination. Vaccination is a pivotal means to prevent the transmission, especially the elderly people. They can reap tangible benefits from vaccination. To further boost this campaign, recently, the certain national authority has published a document requiring localities to be fully aware of the benefits and the urgency of getting the elderly people vaccinated, and do considerate arrangement in order to enhance the vaccination ratio among the elderly people by urging the unvaccinated ones to get vaccinated. The eligible elderly people are encouraged to complete their vaccination procedure. So we hope you could coordinate with us. Thank you. Next question. Thank you from the China Review News. Is the vaccination effective for the elderly people? And what is the difference of getting a booster or not? Mr. Wang Huaqing. Thank you for your question. We are all aware that Omicron is in prevalence. And with the delay of vaccination, then the role of vaccination against the infection is fading away. But still, we know as to the effect of the vaccines in terms of reducing the number of severe symptoms or death cases is working. And we have proof that the vaccines can help 90% of the vaccinated population to reduce the death cases and severe symptoms. For the people above 60 years old, the unvaccinated ones, have higher ratio of deaths compared to those vaccinated ones, and that's about 21 times more. According to the data from Hong Kong Health Commission, for the unvaccinated people, the fatality ratio is 2.87. Those with 2 doses already vaccinated, that's below 1, standing at 0.14. And those with 3 doses, the ratio of fatality is 0.03. So we can see the difference between the fatality ratios. That's 21 times and 95 times more compared to those people receiving 1 dose and 2 doses. And we can prove that the vaccines are very effective in reducing the number of deaths and severe symptoms. Next question. From Hongxin News. My question is about the life necessity supplies in the prioritized provinces. My question is to MOFCOM. What has the MOFCOM done to do the supply guarantee in the prioritized places? Thank you for the question. For the prioritized places, the life necessity supply is in the center of the MOFCOM work. We are people-oriented. We continue to coordinate with those localities. We highlight the speed of our work so that with sufficient supplies, we would give further play to the role of the joint supply mechanism. We help to guide certain localities to do the life necessity supply work. First of all, we organize and dispatch the supplies to ensure the overall supply. For the prioritized areas, we have kicked off the joint supply mechanism by mobilizing the surrounding provinces and municipalities in order to mobilize their market resources and forces so as to guarantee the normal operation of the prioritized places. For example, in Jilin, we organized 5 provinces to join us in the joint supply mechanism by dispatching materials. In Liaoning, we have mobilized 15,000 professionals to pick up and sort vegetables at the amount of 3,906 tons. In Heilongjiang, it dispatches materials to Jilin several times. On April the 6th, it has donated 16,000 boxes of instant noodles and 16,000 boxes of sausages and 1,000 sets of quilts. Hebei province dispatched 1,226 tons of life necessities to support Changchun. And Jilin province also organized the different cities in the province to support Jilin by dispatching the packages of vegetables at the number of 600,000. And in Shanghai, we organized 11 provinces to be supportive. Inner Mongolia, Zhejiang, Fujian, Jiangxi, Shandong, Henan, Hubei, Sichuan, Guangxi, Yunnan, Ningxia provinces have cumulatively donated 18,000 tons of vegetables, 850 tons of rice and flour, 500 tons of meat and eggs to Shanghai. They also supported Shanghai with the supplies of bread, the milk, and others at the number of 5,400 tons. And secondly, we do the coordination work to smooth away the transportation. We guide Shanghai City to establish the transfer stations for the necessity transportation. We hope to provide convenience for the material transportation leading to Shanghai. With Jiangsu and Zhejiang support, right now, we have Kunshan, Pinghu, Xijiao Guoji transfer stations with zero contact, and they are in smooth operation. As Xu said, Jiashan is under construction right now. Up until now, these transfer stations have completed 2,599 tons of materials transfer. Shanghai will work with railway bureaus and the road bureaus to have a connected transportation network. They can arrive at Beijiao Station and Yangpu Station to relieve the pressure on the transportation of materials. For the goods transportation, the one-size-fits-all policy may lead to severe problems, for example, limiting the power of transportation and hampering the transportation of necessities. So for those issues, we will give full play to different entities. We support different entities to solicit new suggestions. Not long ago, the Joint Prevention and Control Mechanism has published a document about smoothing away the transportation for the goods and necessity supplies. Thirdly, we hope to solve the terminal issues. For example, the last 1 kilometer issue, the last 100-meter logistics problems in certain cities by organizing the previous experience in certain provinces. For example, in the contained areas or the controlled areas, they have accumulated some experience in supplies, especially in Liaoning. We will try to exemplify those practices. For example, the 4-1 delivery models. We will arrange one person to be responsible for one building, and there will be one WeChat group for one building. Every day, they will solicit the needs of the people living in this one building and then coordinate the supply of necessities for that one building. And the life wastes and garbages must be taken away with the support of that one dedicated person. That's a very mature piece of advice. By meeting the basic needs of the civilians, those measures can effectively improve the efficiency of delivering those necessities. And MOFCOM is directly connecting with the sorting centers in the Yangtze River Delta area. By customizing the vegetable packages and delivering them to Shanghai directly, that can reduce the manpower and the wastes. Recently, Guangxi has supported 280 tons of vegetables to Shanghai, and they were divided into 40,000 different vegetable packages. That greatly reduces the time of transportation and minimizes the risk of cross-infection. That helps to improve the efficiency of the terminal delivery. Next question. From Caixin, some positive cases do not have immediate time to be transferred to the designated hospitals. What about their containment measures in their neighborhood, and how can the whole community prevent and control the further transmission? Mr. Wu Zunyo, thank you for the question. For some newly diagnosed positive cases, if they are unable to be transferred to the designated hospitals or the isolated facilities, when they are staying at home for isolation, they should take protective measures to avoid further transmission to their family members or the neighbors. First of all, try to prevent the transmission within the family. The positive cases should have one single room and do not share rooms with the other family members. Secondly, they should have, at best, an independent lavatory, and they shouldn't eat together with their family members and do not talk with the family members. Secondly, try to limit the number of infectious cases in the neighborhood. There should be instant disinfection of the living environment of that infected person. The family members of that positive case should not take chances and visit the other neighbors. They are forbidden to talk with the other neighbors. For the neighbors living in the same building or the same community, around the time that patient is transferred to the isolated facilities, this whole neighborhood should be contained and locked down. So in that period, there will be stringent requirements. All the households in that neighborhood should stay at home and are not allowed out. Everyone must abide by the requirements of staying at home during that period. During the days of controlled management and health observation, everyone in the neighborhood should pay close attention to their health status. Any throat pain or cough or fever symptoms. They could also use the antigen test. If any symptom occurs or if the antigen test is reported positive, come to the local health entity as early as possible so as to have early intervention. Next question. Thank you from the Economic Daily. What is the price fluctuation of the agricultural products? How to ensure the stability of the prices? Mr. Xu Zhengbing. Thank you for your questions. The NDRC puts high premium on the stabilization of the supplies of key necessities and their price. We have a dynamic monitoring of their price. In general, recently, as to the prioritized food supplies, they maintain a stable price. For the rice and oil, they have a steady price, and the pork is fluctuating at a low level. For lamb and beef and chicken meat, they have a stable price. For eggs, they are rising up a little bit among stability. But still, we must come to the fact that since mid-March, the price of vegetables has been undermined by the poor transportation and logistics. The cost has increased, so the price of vegetables is rising up. Especially in Shanghai and Changchun, the prices of vegetables are up a great deal. But recently, because of the policies in place, the prices have been taken down gradually. Since early this year, NDRC has repeatedly held the video conferences and published notifications about the stabilization of the key necessities prices. It guides different localities to stabilize production and increase storage and connect between production and sales with contingency plans, especially for the vulnerable people. There should be more subsidies. We also work together with certain entities to readjust the price of pork. All the localities are working actively, and many cities have made their plans or contingency plans of stabilizing the prices. There may be smaller packages of those necessities. Some cities have added up the storage of eggs and vegetables. We have a lot of people-friendly activities. Based on the price fluctuation, we have dispatched one lump sum subsidy to the vulnerable groups. Right now, we have abundant supply of grains and oil, and the winter wheat is in good condition. Now it's the springtime. Production is going on smoothly. As to the pork production, it's basically kept within a reasonable range. For the eggs and poultry, production is going on well. The area of vegetable production is higher than that of last year. So, to keep a stable price of some prioritized food, we have a very good starting point. In the next step, NDRC will continue to coordinate with certain entities in order to hold those people accountable for the vegetable basket. And we will guarantee good distribution of the vegetables and have some evaluation system in place in order to guarantee the supply in the market and meet people's demand. Thank you. Next question. From the cover, once infected by Omicron or Delta, will there be a resurgence of infection? And what's your suggestion as to personal protection? Mr. Wu Zunyu. Thank you for your question. If one person naturally was infected by COVID, he may develop immunological ability, but that immune system cannot prevent him or her from a repeated infection, and it doesn't last long. Either Omicron or Delta viruses with no protective measures in place, if he meets another positive case, it is still possible for that person to have another infection. According to the study, the risk of a repeated infection by Omicron is higher than the infection by Delta. As we know, the COVID-19 virus is mutating all the way. Whether you are infected by one specific virus or by a combination of two different viruses or their variants, we must have some measures to protect ourselves in order to reduce the risk of infection. So, what are those policies that should remain unchanged? Individually, we must put onto ground those preventative measures like wearing facial masks, keep a good sanitation of your hands, and keep a social distance. And also vaccination. Thank you. In the interest of time, we can allow the last two questions, please. From the paper. Now, it's the season of those flying particles, like the fly weddings. So, will it be another channel of transmission of COVID? Thank you for the question. As we know, usually the COVID-19 viruses will not infect a healthy person through the catkins. It's usually transmitted through the fluids, especially the small particles of these fluids, by coughing or sneezing. The sprayed fluids may carry the virus. And the sprayed fluids are very small. It's usually 1 mm, and it can be transmitted within a scope of 1 to 2 meters in the environment. And if a healthy person inhales that sprayed particle, he may be infected. If you ask me if the virus can be transmitted through the flying catkins, my answer is no. In the past studies of the last 2 years, we haven't found that inhaling the catkins will lead to infection. And also, up until now, we don't have any reported case of that transmission. Last question, please.
谢谢发言人向金银岛报记者提问。我想请教一下王华庆先生，过敏能否接种疫苗？
My question is to Mr. Wang Huaqing from Hong Kong Economic Review. For the chronic disease patients, can they get vaccines? Thank you for the question. Actually, we have answered that question before. And speaking of those patients, especially the patients with contraindications, for example, the allergic reaction to the COVID-19 vaccine, and secondly, if you're allergic to the components of the vaccine, you cannot get vaccinated. And also, if you have been allergic to the other vaccines with very severe allergies, then that's one of these contraindications. There are other three conditions for you to consider. For example, you are suffering from a fever or some diseases or the urgent fit of a chronic disease, then the vaccination should be delayed. Once you recover from those symptoms, you can get vaccinated. You mentioned about the chronic disease patients. We have been highlighting that for the people suffering from chronic diseases, especially the elderly people, the risk of having severe symptoms or even death cases is very high once infected by COVID. So this group of people is in higher need of protection from vaccines. Usually, for the patients suffering from chronic diseases with a regular administration of drugs, if they are not in the emergency fit of their disease, they can be vaccinated. Based on our evaluation of their chronic diseases, you could counsel your clinicians, and your clinicians will do an evaluation of your status and give you advice about whether you should be vaccinated. Thank you, Mr. Wang Huaqing. And today, our experts have introduced about the updates of containment measures and the guarantee work of our necessity supplies. Thank you again. There will be other pressers to follow. Please stay tuned with us. And this is the end of today's presser. Thank you.